This activity is a hip hinge to a table. So to perform this activity, you may have to put something on the table to elevate your body up to a higher level. I am just going to go on and start from a bit of a lower level here. So what we're going to do in this activity is we're primarily trying to keep the back flat and the abdominals engaged so that as we shift back through the hips, we don't get excessive motion here in the trunk or the pelvis. So we're going to put our hands onto the support surface with our back relatively flattened, and then we're going to move the hips backwards as we let the chest come down. And as we do that, there's going to be a point where the back wants to round out a little bit more. And so we're going to monitor for that point, and we're only going to go to right before that starts to happen. And then we're going to come back up. Okay, so a way that you may be able to help sense this a little bit is to actually use the hands to push back a little bit from the table, or you may be thinking about shifting the weight into the heels a little bit more, or folding over here in the front of the hip creases. So if someone was going to come up and push right at the front of these hip creases back, that can sometimes help you get that feeling of hinging just at the hip. So again, that's a hip hinge to a table. We're doing that primarily to improve our ability to keep that neutral spine and pelvic position as we perform a hinge movement.